11, 13, 15, SCF and GM-CSF, and other inflammatory chemicals like cyclooxygenase, which is blocked by anti-inflammatory ibuprofen, and interleukin, which is blocked by Singulair or montelukast. There's 30 different inflammatory chemicals that are released in COVID-19. Those are the exact chemicals that have been proven to be blocked by budesonide. It is a perfect match. When you overlay what budesonide blocks from being released to what COVID-19 releases, we have an exact match. We have the answer for the problem. But the key is it needs to be given early.
For people that watch this, like you said, you've had a lot of success with it so far. For people that watch this and think, oh, this is the miracle cure, is that the case with this, or do you not want people to get that message?
What I can say is that I have 100% of the patients that I've treated this way recovered. And if you'll look nationwide, statewide, citywide, people are dying from COVID-19. And I believe there are many factors. A person's underlying health is a factor. Kathy's here to say, I have had the worst of underlying factors and I recovered. And so early treatment with the right medicine is key. And so if someone's not being treated, they need to be treated. And they need to be treated early. And the NIH study is looking at people on the ventilator with pneumonia. That's not early, that's late. And that is when someone's already at risk of death. I want my job, whether it's this or any other disease, is to prevent loss of life and limb, and to ensure health, and to avoid upset health-wise. And this is a disease that's a killer. We have something that works. And it's not just my opinion. It takes a lot for the NIH to do a study. It takes a lot for the country of France to get organized and do a study. And Spain is socialized medicine. It takes a lot for them to do anything, and they're planning on doing a study on it with the exact same treatment plan, inhaled budesonide. So I would not want any of my loved ones to not be treated for a deadly disease. If there's a treatment that's an option, I would want that for them. And I would not want to do what communist China is saying, which is being the strategy of the World Health Organization. Wait until you're very sick to seek help. If you got mild to moderate symptoms, even if you're positive for COVID, just sit it out. That's a bad idea for any disease. This disease is a killer, and there's a treatment that works. So my message is the right treatment is inhaled budesonide. Use zinc, use an antibiotic to prevent a secondary bacterial pneumonia. If they're an adult, you can give them a baby aspirin, but the silver bullet of the disease, COVID-19, is inhaled budesonide.
And where does the FDA, where do they stand on
So
this?
the FDA has no approved treatment for COVID-19. So tell that to my patients that are dying. That's what some doctors are telling their patients. That's what some patients are being told by their healthcare system, by their hospital, by their emergency room. Go home, there's no approved treatment. And not given anything but a prayer. And I believe in prayer, but I like the practicals. And this is a medicine that's been out for over 20 years, super safe. It's been used on 2-pound preemie babies in the ICU to the elderly safely. I've used it for over 25 years in my practice. Every doctor uses it without blinking. It doesn't have the risk of hydroxychloroquine, which has been controversial lately because of the potential risk with the heart. This medicine doesn't have that risk, and it's working every time for my patients. My desire is to help save as many lives as possible, either people in front of me or people that I never meet. My goal is to help, and this seems to help everybody that uses it.
Do you plan, what future for you? What do you plan on doing with it? Do you plan on reaching out to the FDA or anybody else to try and say, hey, look what I found?
So I'm currently writing a paper that we're going to submit to the medical journals and the science journals, because this is solid scientifically. And instead of the imaginary models and the imaginary theories that we're going to have a second wave because someone said so, maybe we will, maybe we won't, but the bottom line is there's no science behind what they're saying. And it's anti-science to not treat somebody with something that is working. I'm using something that's scientifically sound, and I'm using good judgment, something that's intuitive for every doctor to use a respiratory anti-inflammatory for a respiratory inflammatory problem. And this works, and I have a success story. You know, if there was a treatment that only worked 50% of the time, that would be better than what's being offered right now where they say there is no approved treatment. But I'm having 100% of my patients recover. 0% of my patients die. I want to keep my patients out of the ICU on a ventilator if at all possible. I'm having patients that are deathly sick with serious health problems recover. I think it's worth doctors talking to their patients about.
Is she an outlier with cancer, or do you have other patients that are just as sick?
I have other patients besides Kathy Kathy's been wrestling with 2 kinds of lymphoma. She's currently being treated for those, fighting those cancers with chemotherapy, had radiation a month before she got COVID. And so her situation is extreme, but I've had the other extreme patients recover as well. A patient with a 50-year history of smoking, had her chest open for 4-vessel bypass surgery, is being treated for thyroid disease, is elderly, is being treated for high blood pressure, and she recovered entirely. And she said that same thing that I've never heard until COVID-19. I feel better with the treatments. I've never heard that before. Penicillin was discovered by observation. A scientific fact is observable and reproducible. And I have something that's observable and reproducible, and the patients are voluntarily telling me without me asking, I feel better with the treatment. I'm recovering, and my coughing fit stops. My shortness of breath and chest pain go away with the treatment. That's an observation that I've made, a scientific observation. This is all science.